Yay Networks.
Hello, everybody. It's another beautiful day in the neighborhood, and we're still neighbors. Yes, and we have another guest today. You know, we're in the month of May. We're still in the month of May. You know, it's Mental Health Month. And, you know, we have to talk about our mental health because a mind is definitely a terrible thing to waste. That's the United Negro College Fund. You didn't know that. So I have my guest there. And, you know, without further ado, I'm going to just bring the guests up. So, ladies and gentlemen, put your hands together for Miss Michelle. How you say your last name, Michelle?
Rankine.
Rankine.
Yeah.
Hi, Michelle. How are you?
Hi, Gary. Nice to meet you.
Nice to meet you too. Okay, now, Michelle, it's Mental Health Month, and I know that's what, you know, everybody just need their mind, honey, because without our mind, how could we function? You know, sometimes I lose mine, but I get it right back. Yes, honey, I just snatch it right back, honey, and I start thinking all over again. So tell me, Michelle, so how's everything been going, honey? And we're gonna talk about this Mental Health Month situation. I know you got a lot to share with us, so we can't wait.
Sure. Well, again, my name is Michelle Rankine. I work in the healthcare space of helping seniors in home care. And in the aspects of mental health, I really wanted to bring attention to the fact that mental health in regards to caregiving. I personally feel there's 4 types of people, right? Mm-hmm. You're either a caregiver currently, you're either being cared for, you're going to give care, or you're getting care right now. So, I think with that perspective, everyone can be affected due to caregiver stress, caregiver fatigue, and caregiver burnout. And I think right now, as the population is aging, we're seeing even more stress from individuals currently who are not only caring for their children, they're caring for their parents. And that level of stress is a lot, and they need support. They need resources to be able to navigate those spaces.
And you know, Michelle, I am so glad, honey, you're here, because I tell people that all the time. Because I used to work for visiting nurses. I used to work for visiting, and I used to work for Baylor. I worked for so many. When I was in the medical field before I got in the radio and TV, that's what I did. And you know, I tell people this all the time. And you know, it's a way, I guess you gotta say it to people, because sometimes people get offended or get upset about the caregiver. I will never forget, Michelle, when I was working for visiting nurses, and I used to go do home health, sit at the patient's house when I was doing my sitting and what have you. And then in the hospital as well. When I had a patient, this patient, she used to come sit with her husband every day, honey. Bless his spirit, honey, because he was sick, and you know, and what have you. And she would go sit with him every day. And honey, one of those days, like she had been, I mean, maybe I'm saying about a week or whatever, honey, she went home and died. And he was still laying in the bed. And I tell people this all the time, honey, we gotta take care of mama and daddy and all that stuff when they get older. We all understand it. But what we don't understand for the most part, and I'm gonna just say black people, because I'm black. I ain't putting mama in no nurse. Oh, mama ain't going to no nurse home. I ain't putting daddy in no nurse. I ain't doing that. Honey, if you could do it, you might want to talk to your other family members to do it, because, girl, after you sitting there stressing out, taking care of them, but you don't realize you're being stressed out, hell, you go home and die, and they still ain't in the bed. And that's what the nursing homes and the convalescent centers, or whatever you want to call it, however you want to dress it, that's what they are for, to do that. Because my parents always say, if they get sick before us, don't sit there and take them, put them in a home. And I tell people all the time, Michelle, once you put them in a home, honey, if you put them in a home and just leave them there, they're going to die. And the people there are not going to take care of them. If you show your face every day, baby, at that nursing home, and let them people know that you are there for your parent, honey, they're going to take good care of your parents, and you don't have to worry about that. Am I wrong?
No, you're absolutely correct. And you're speaking exactly to the statistics that, I can't say statistics. 30% of caregivers die before the person they are caring for.
Yeah.
And that is what is happening. Exactly what you're saying. We as minorities, Black, brown, we believe that we must care for our spouse. We must care. And I do believe that is part of it. And there's ways to do that caregiving and have respite and have a sitter and have someone be an advocate for you. And you have to be realistic and accepting of the terms of what you can manage. If you are not a professional caregiver, understand that is not your scope. And maybe a residential care home is better suited, maybe an assisted living, maybe a nursing home, depending on your level of acuity that you're going to be needing. A lot of people, when they come to this point, it's the fact that you're speaking to so correctly is denial.
Yeah.
They're like, no, I have to do it all. And you put that burden, you put that mental stress, which then affects your physical and affects your overall health and well-being. And I just find that having good advocates in healthcare is very hard to find. And you have to take the time to research to get that help. When you're in the hospital and you're going through the discharge process, a lot of people don't read the paperwork that they're given. They just don't have the time. Everything is in there that you will need. And those social workers that are part of your discharge, ask the questions, say you need help. And there are resources out there that they have to give you. I'm pretty sure when you work for VNA, there's resources that VNA has for all their patients throughout the Metroplex. But I just feel that we forget, especially as a society, to take the time of when you feel triggered of stress, that means you need to do something here, right?
Exactly.
That soul and self-care is the same trigger as hunger. When you are hungry, you go eat. And it's a reoccurring thing. And when you have those moments of stress, overwhelm, discomfort, okay, what do I need to do to escalate this down? What practices do I need to put in place? And I need to now step out and really get some self-care. And having that understanding of what self-care is. It doesn't mean doing your nails or getting
exactly. And you know what, though, this is why it's so much abuse too, with the elders and people, because, especially like even in your own home, because you want to take care of mom and dad and stuff, but you don't, and at the time the parent or the patient could be, say for they're a little bit going through senility, senile, what have you. And honey, they may not respond the way you want them to respond because they don't know. So you get aggravated and agitated, and then before you know it, you're abusing the person and stuff. But you want to still sit here, and I want to take care of mom, and I don't want to put her in no home, and so like that. And now, honey, you're not helping. You just hurt yourself. And if you're not trained, honey, to turn the patients when they need to be turned and bathe the patient and do all the things that you're supposed to do with the patient, honey, there goes, you get decubitus, you get the bed sores, you get all that stuff, honey, but you still want to take care of mama. You're not helping mama. You are really hurting mama, but we don't realize that, though, but we want to take care of them, though. No, ma'am, honey. You have to do that, and you don't have the guilt. You got to get out of that guilt. And regardless of what people tell you, you put your mom in a nursing home. Well, girl, look. I had to do what I had to do, honey, and help her. And the sad part about it too, mama didn't live her life. She want me to live mine too. So let me just help out the best way that I can. And this is what I'm gonna do. But just go up there and to that home or wherever you put them in, and to make sure you see about them on a daily basis if you could. And then if you can, and then there you go. Everybody will be fine.
Exactly. Especially when you have a patient, like you were saying, senile, dementia, right? Mm-hmm. Dementia, a lot of people, I even see it with my own family, Gary, when you have someone that is beginning to show stages of mild cognitive impairment, just forgetful. We start forgetting things from in our 30s. But as you're aging and you're in your 60s and your 70s and you're seeing the progressive repeating stories and they're probably not recognizing you, all those factors come into play for you to say, you know what, mom, you're right. A lot of us want to contradict what they're saying. No, you need to meet them on that journey of where they are when they have a dementia moment or a moment where they're somewhere else. And that type of acceptance that she is somewhere else and I need to meet her. So, for example, they may say, I don't, do you know that person over there? They did this. And they're like, Mom, you didn't leave today. Now that's giving that person, the care recipient stress. They're like, what do you mean? I'm on this journey. And I think a lot of people don't realize it's like, I call it therapeutic lying. Yeah, Mom. So tell me a little bit more about that. What did they have on? Where were they? Mm-hmm. And then if you need to redirect them, if they go too far, just redirection is all you have to do. Just redirect, but you have to be soft and kind when you're dealing, and you can't escalate because the energy you perceive to someone in caregiving, especially a dementia patient, they're going to react back. They feel energy. And so I'm always like, you have to be at a good headspace, mental health, de-stress, when you come into a room with a patient that has any mild cognitive impairment, because they are feeling that and they will take that stress on, and it's going to be healthier for you to accept where they are in their health journey.
Yeah. It's almost like with a kid. You know, when a little kid's a kid and they say, "Oh, mommy, look at the monster," and then you entertain it and say, "Oh, yeah, that's the." It's the same thing, you know, because the parent or the elderly go back to their child stage, you know, child stage and whatever. So it's almost similar to that and stuff or whatever. But you know, if you don't know that, this is where all the problems come in, and this is where all the denial and all the stuff come in and stuff, and then people just don't realize it. But I've said it so many times before about, what people don't realize, when people get old or when you got to take care of a person, in a facility or what have you, it's not, oh, you want to keep them at home. It's not really what it seems, honey. Then you have about how stressed you are. I can't go nowhere. I can't do this. Then you got to beg and plead for somebody. Then you get somebody from around the corner to come sit with the person that don't know nothing about them almost. And, there you have it. So I think if we knew more about this situation, I think it would be a little bit easier.
I think you speak to a good point that a lot of people forget. It's not, when it's a child, we can accept and then we prepare for that, right?
Yeah.
But when it's your senior parent, we forget that we need to accept and prepare that too. And I think that level of preparation is really taking that deep dive of whatever that disease process is and understanding what that journey is. And I think a lot of us avoid it, right?
Yeah.
We don't have time for it. There's so much happening right now. I just don't have the time to take that journey. But we accept when we're having children, okay, this is my child, you prepare, you go through the full process, you educate. But when it's caring for a parent, a lot of us forget. And a lot of us seek to just taking it on all by ourselves. And we don't talk about it. And I'm excited that we're here to talk about it because we don't talk about caring for parents.
No, we don't.
And how isolated they are. Seniors are the most depressed and the most isolated population. The only time on average that people will see their parent is holidays. There's a lot of gap in between. And they also are afraid to tell the truth. So they'll say, oh yeah, baby, everything's fine. But really and truly, they may be completely incontinent.
Exactly.
Right. And the realities of what is day to day. And that's why I'm such a big advocate of having a caregiver, a professional caregiver come in the home. It's a relationship that has to take time. They're not just automatically going to trust someone, but over time, they're the person seeing them day to day, seeing their struggles, and lean on that caregiver when the family needs help. And we have to realize that there's so many resources for caregiving, whether you're a veteran or, aging and, looking to Alzheimer's Association, Parkinson's. There's a lot of resources out there to get extra help.
Yeah. And we just got to seek that out. But my mama, she used to sit with this lady, a very wealthy lady in Beaumont. And my mom used to sit with her. And I always tell everybody, and I used to tell my mama, and I'm going to just say her name was Miss Dorothy. And I said, if Miss Dorothy, first of all, she was very lucky because she had money. So she was with her. So my mama sat with her. My aunt used to sit with her. And then they had another sitter. But I said, and she was, senile, whatever. She went through dementia and what have you. I said, but if that woman woke up just 1 second and looked around and realized that she was in her house, she was good and comfortable because she had good sitters and stuff. Because, she was there. So to go back to, it's not easy, but it's not hard either. But you do have resources. Her resources, but they just happen to have money. So she had somebody to come in and sit around the clock with them and stuff. So that was a good thing for her, honey, and stuff. But as for the opposed to people that don't have money and have to have a family member or somebody to sit with them, because they don't reach out to find out the resources. If you reach out and find out the resources, trust me, it could be a better situation for everybody, like I said earlier, and people would be more comfortable. And sometimes I think it would even extend the lifetime, a lot of these people and stuff like that. Because, half the time, you don't have nobody, you got somebody thinking they sitting with you, bring you a piece of bread every now and then, you land up in the bed, honey, deteriorating or what have you. It's a sad situation. I've seen so many cases like that. Like I said, when I used to work for VNA and I did my other private duty work. So it's a sad thing, though, but I'm so glad now that hopefully it's getting better and people reach out and get, seek the resources and what have you to do that. Because I know if something's happened to my mama before me, I said, honey, we definitely either, if I'm in the situation I'm in now, I would have her here with me, but I would have help, because I know better. But if not, honey, if she refused and don't want to stay and I would put her in a facility, trust me, I will be there. I will be there every day, honey, because like I said, when I worked in the nursing homes too, I saw how that went. But I would definitely be there to check on her, make sure she's being turned, honey, make sure, honey, she's dry, make sure her room is clean. It's a lot to go with all that stuff, honey. So, and you just have to know. If you don't know, then that's where we fall off the ledge or what have you.
Yeah, but there's something to that where are we even preparing for when we're aging now, right? A lot of people don't invest in long-term care insurance. Long-term care insurance would help assist once you age, or God forbid, if something happened to you where, you're disabled and now you need around-the-clock care of some sort. We're not educating ourselves and preparing ourselves for crises and things that are going to happen. And especially when we age. And I think especially amongst us, we're not preparing. And we're just, we have life insurance. Okay, that's when you pass.
Yeah, that's dead. That's for the next person. Ain't
that's for the next person. What about right now? Get a long-term care policy that will be able to pay for a caregiver. Would be able, if you have to go to an assisted living, it would cover those costs. Or if you have to be in a nursing home, private pay in a private room, it would cover those costs. Those are things that we can do from now. And it's cheaper if you do it now because you're healthier. It's all part of the assessment of how long you will live and that cost factor.
Yes. So it's been, and I think about it all the time. I say, Lord, if something happened to me after my mama, who in the hell gonna take care of me? So, I have to get that situated or whatever, because I have brothers and they all married. I ain't looking for none of them to take care of me or do. Because I think, I just think a certain way. All I think about is if something happened to me, if after my mama would have you, and I have the little stuff I have, they gonna ride my ass blind, honey. Give me a piece of bread here and there, honey. Ain't nobody gonna come. They gonna just steal. Because, honey, they're going to come get all what they could get. And if you got a little damn money in the bank, honey, you're going to be signing that over. They're going to take your little money, and it's over. So, honey, so I definitely have to be the one to look out for myself. Because if not, ain't nobody going to look out for it. And the first thing they're going to say, girl, you remember, honey, he was doing radio and TV, he had all that, and I ain't got nothing. He pissing on himself and all that. That's what people going to do. I'm sorry, Michelle. I'm just telling it how it is. So, but
I mean, it's the reality of what's going to happen in time, right?
Yeah, so we just have to, like you said, you have to think about all this stuff, but we don't think about it because I know I got everything planned for the funeral, but I ain't got everything, I got to get the stuff planned, honey, like you said, for the long term, because it's just long term come before the funeral. But it's a thing that we definitely, have to think about all that stuff.
We have to because we're living longer, right? We are living longer. We're trying to practice healthy lifestyle. So when I look at it sometimes, I'm like, okay, Michelle, if you live to 100, what's that going to look like? What's that going to cost? And who's going to be here, right? And so I think that we're planning our estates and who will be the executor, who will be your POA, who's going to make those decisions for you. We have to always understand that document needs refreshing. It's no different than a car. It needs maintenance and making sure you have the right attorneys that are going to keep adjust to that as we age. I always think of like my grandma, everyone was passing. Her circle got smaller and smaller as she aged, right? And that's why I actually think it's important for seniors to live in communities where other seniors are, because they don't get the opportunity to make friends.
Exactly.
As they normally used to. And unfortunately, that's going to happen. People are going to pass. Their good friends are going to pass. And if they have no community and they don't have a resource, or they're going to this senior centers or such, that they need that community, and we need to help them build that. I know for my grandfather, he was antisocial, but so I had to force him to get into place. I had to force him to go meet people. And that's what we have to do when we do visit our grandparents on holidays. How can we get them connected, whether that's small groups in church or somehow in the community, so they can have an opportunity to live with purpose?
Yeah, and you saying elder people, that young folks too. My circle gets, I done lost half of my friends, if not 3/4 of them. And I socialize with people and stuff like that. But my trust factor is just not there like it should be. But I could understand that. So it's like my mama turned 81 today.
Oh my word!
Yeah, she turned 81, and she's just starting to get out more and socializing with a group of women, which I thought was so good. Because I'm like, girl, you really need to get out instead of stuck in the house. Because after my daddy died, which she didn't socialize much, but she had, they had a few friends and what have you. So you definitely have to do that, and it's definitely a good thing, if you could get in a community, with people, likewise people, what have you, and do that. But back in the day, I don't know if that's still going on now. Michelle, maybe when people went to a nursing home or what have you, they had to sell their houses and stuff to get in the house. And I know that's why a lot of people say, I'm taking care of mama at home. I ain't letting her house go. And it was different then.
That will happen. I think part of the process that we don't do is speak about this process early. We end up having to sell and relinquish our assets to qualify for Medicaid pending room, because if not, it's going to cost a lot, right? And then a lot of us fall into the middle class area where it's just we don't have enough, and it's just like you're right in the middle, right? And so if you do good financial planning with an elder law attorney, so you can put assets that your family members have in like a irrevocable trust, then you can qualify for Medicaid. And I think a lot of that is just really speaking to an elder law attorney, so you don't have to sell your mom's home. You can still have that home and make sure that her assets become less, so she could qualify for a Medicaid bed if that's what the need is.
Yeah. Yeah, it's just interesting, but this is definitely, I'm glad we talked about this today, because I've been talking about it and, speaking on it. And so, like I said, I've worked in it, and more so with the mental health thing, because honey, I'm a mentally health challenged person. Look, I'm bipolar, and I've talked about that so many times. And and I tell people, this is funny though. I would tell my colleagues about where I used to get my help from, and they're like, ugh, because I used to go to MHMR right there, honey, on off the highway. I said mental health, mental retardation. Damn it, that's what it was called. So MHMR, and it helped me out tremendously, honey. I loved going there. Sometimes when I used to get there, I used to feel like the only sane person there, because I was like, ooh, people used to look a little unique there, but I just knew, honey, I just had my little episodes and stuff, and take my little lithium, honey, and have a good day.
Yeah. But Gary, I'm so happy you mentioned it, because I know for myself, working in the caregiving space, and even as maybe when you were a sitter, you're probably an empath. You're a person who feels for people.
Oh,
and
yes.
You're going to take that stress on. I saw it for myself when I got into this industry 11 years ago. I was like, oh, I really need to talk to somebody separate. I mean, you have your own personal stress, and then I'm taking on a profession to care for people in their most stressful time with anything that they're happening, whether it's going on to hospice or a family recent diagnosis. It's very stressful. So my therapist is my best friend, I feel, at times. Because I have to be able to release this in a responsible way, and I have to be able to get clarity so I can do the things I want to do.
Yeah,
and
exactly.
If this mind is too full, oh no, that is a recipe of destruction.
Exactly. And that's one thing. That's why I love going to my therapist and talking to them and what have you. And I tell people about it all the time. I'm like, back in the day, oh, you crazy. Because we didn't know no better. But honey, now I tell people about it. I'm like, I love sitting there talking to my therapist or whatever. And it helps me to talk to my friends and to deal with them, because, you'll be amazed some of the things that people go through and they just don't know how to channel it, what have you. But, if I talk to them and try to help them out, because I get therapy and I take the therapy and apply the therapy to other people, what have you.
Yeah, me too.
But it's very interesting, but it's very much so helpful. I mean, without therapy, honey, I wouldn't even be here to sit here and talk to you, because, the stuff I done been through, honey, cancer and mental health, and then friends that, put you through stuff. I used to carry everybody's problem and it made me depressed. But going to therapy, it helped me out. So now, honey, girl, you can tell me your problems. I can hear you. Oh, girl, well, bless your soul, honey. And I can keep it going, honey. I don't have to carry that problem. I can hear it and not carry it anymore,
Right.
So that helped me out a lot. So I think without it, honey, I don't know where I would be right now today, first of all. And I wouldn't even be able to do the work and stuff that I do without it. So it definitely helped me out a lot. So.
Oh, hands down. And I think for anyone in a caregiving space, ask for help, and reach out to the resource. There's free, I know for Collin County in Texas, we have free resource and free counseling for caregivers. And in addition to that, it's okay to be vulnerable. Kind of like what you said, I have to talk my story, but if you're not talking to a therapist, you can't do it in a mannerable way that can connect to others so they can feel like, you know what, he got help and look how he's thriving.
Exactly. I tell people, I say, if you want to walk around and call me crazy or whatever you're going to say, girl, you need to be me then. I said, because look at what I'm doing, honey, and how I'm making it, honey. If that's crazy, then girl, I think everybody should stand in line to be behind me then, because hell, it helped me out a lot. And like I said, it's just, it's no big deal.
Yeah. It's
no big deal, honey. So, just handle it. Just, let it go. This too shall pass. And that's what it does. So, and I tell people today, honestly, Michelle, if I got out of radio and TV today, I said, I'm going back to nursing. I mean, I have a degree in business management, a bachelor's. I said, but I'll go back and get my degree in nursing because I love nursing. I love doing it. It was so nice. And, my dad was a mortician. So I'm like, well, I wouldn't be that. But I mean, I love doing nursing. I love the terminologies and I loved it. It was fun to me. So, and that was just what I did.
That just speaks to your caring heart. I love it. Absolutely. I did not know that about you. And that is amazing to hear that. And I think it's cool what you mentioned in regards to, when we speak life, it's also the opportunity to give gratitude. I always see on social media where we take our children and we speak life in them and give positive affirmations, but we need to do that too.
Exactly.
Do that too. You got to speak it. You got to speak it. And your words are so powerful. I'm so careful about the words and choices that I say out loud about myself. Like, you can do it. You have to put that. It's funny. I made a purchase the other day and they're shower affirmations. And I just wet them things up in the shower and I read them out loud just as I'm showering. Because I need a reminder every day that abundance is here and everything will be okay. And there's nothing more that I can't handle.
That's right. One thing I learned when I was going through, I don't know if it was a breakup or something was, but that little saying that we used to say as kids, sticks and stones may break my bones, but words that never hurt, that's a lie. Words hurt. Because let me tell you something, honey, when you rewind that tape in your head, honey, what that person said to you and stuff and how that made you feel, it hurts. So I say, we need to stop saying that, honey, because words hurt. But we still say it. So I don't know what the kids saying it now because they just cursing each other out and doing what the hell they do. They shooting each other now, so they ain't using no words. So I don't know. But it's just something, but you keep living and you learn and life goes on and there we have it.
Yeah.
So, well, Michelle, I mean, is there anything else you want to talk about before we go?
No, I think we talked about all we can.
And I'm sure I was sent your credentials and all that other stuff, but I can't find the email, but I say, so I'm gonna just talk off my head, honey. So, but
you did a good job.
Yeah. So, the thing is, and I tell people this all the time, you gotta know how to improvise sometimes. And it's just like when I do my stories in the morning, my celebrity gossip. If I talked about Beyonce once, honey, I mean, when I get another story, you just need to know how to put all it together and make it work. So, I don't have to read the whole thing and I can just put it together and what have, but nevertheless, Michelle, I want you to tell people how they could reach you and, all that other good stuff.
Yeah, sure. You can reach me through social media, Michelle Rankine PhD on IG. You can connect with me through my business, Right at Home Louisville on IG, rightathome.net, Collin and Denton County, and on TikTok, Right at Home DFW.
So do you, are you still, I'm sure you're probably not, but you don't do the visits anymore. You probably just visit the employees or whatever, but you're still doing the visits.
Me personally, I'm not out doing visits, but I do a lot of training with my staff.
Yeah. Well, good. And your business is in Dallas.
Yes.
Collin County?
Well, actually, I have 3 franchises for Right at Home. So I have Collin County, Denton County, North Dallas County, and Denton County.
Well,
And Tarrant County. Excuse me, I've repeated myself.
Yeah, Fort Worth.
Yes. So
Well,
we're in Colleyville, Louisville, basically all the northern suburbs of Dallas.
So you didn't want to do nursing or anything like that. So you just went to well, it's all professional. Which way instead of doing the hands-on, you decided to do the business.
You know what's interesting? I have no healthcare background technically. I went to school with the idea to be pre-med, and I was obsessed. My grandpa was like my best friend, and he was really into sports. And so I said, you know what, I'm going to focus in sports. And so I graduated in kinesiology and then went and did sports management. And I was working at the United States Olympic Committee. And then life happened to me, to be quite honest, what got me to this field. My brother was in a car accident, paralyzed, and needed around-the-clock care. And so that's how I got introduced to caregiving. But I will tell you, it has been the biggest blessing making that career change because, like I said earlier, there's 4 types of people in the world. And at one point, you're going to be a caregiver. So I've been a caregiver for so many different family members, and I'm happy that I have this knowledge to share to my family. So we have the resources and we're prepared as my mom ages and as my aunts and uncles. So it has been a blessing for me to have the opportunity to have changed my field. It wasn't a blessing to have that happen to my brother, but it was a good learning lesson for realizing the things that you want to follow as your passion. I always enjoyed helping people, but I didn't see that as an actual career until that happened.
Yeah. You know, it's funny. Most people I know that majored in kinesiology, however you pronounce it, and they wind up being trainers at the gym. Because I got a couple of friends, that's what they majored in. They trained. I'm like, girl, you went to school to be a trainer? But I guess that's what it is. So. Well,
I wanted to do the research side of it. So I actually went to school and did my PhD, and I graduated with my PhD, but in education, focusing on sports, because I'm amazed also at the theory of sports and how sports makes money as a business and how colleges and universities expand on that and leverage that. So I'm definitely a researcher.
Most teachers should have majored in kinesiology, honey, and be sports people, because hell, they sure ain't getting paid, but the football player getting paid millions, and hell, the teacher getting paid $1. But that's just my opinion. That's what it is. So, well, Michelle, thanks again, honey, for stopping by, and good luck to you and your endeavors. And hopefully, everybody watch this and get in touch with you and they can learn something, because we definitely need to know this. We definitely need to know how to take care of the elderly as well as the young people that need help as well. So
thank you so much, Gary. It was a pleasure to meet you.
Nice meeting you. Yes, nice meeting you also. All right, I'm having to put you on hold for a minute. All right, y'all, that was Miss Michelle Rankine, and thank you so much, y'all, for stopping by. And hopefully you learned something today, because you know what, we definitely need to help our elderly as well as help the young people. Anybody that's incapacitated, we definitely need to help them, because people think that they could do all these wonderful things. Everybody want to be Superman and Superwoman, but sometimes we just weren't built for that. That's why people are out there to help. All right, I want y'all to have a great week, honey, and take care of yourself. And you all are loved. And Feliz Navidad and la 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 la. And bye-bye.